all on board already, there is a chat button on your screen. And what I'll do is I have to kind of toggle back and forth between the presentation and the question screen. So I'll do a slide. Each slide will talk about something different. And then I'll stop for a minute and toggle back to the question part. And then you guys can chat or ask a question on there. Everybody should be able to see the question so we can help answer that for you. Thank you, everybody, for joining on. This is kind of different. This is going to be kind of our COVID Hawthorne University, so we can still get information out to you guys, but not have to, we can do it more in a safe environment by this way. So definitely I'll want to know how your feedback is after today's presentation, just so we know how much you like it and if we can maybe do some more of these in the future.
Are you ready for me to move?
So tonight, what we're going to do, Kate, do they see me talking?
They see...
Because it's going to interfere with their PowerPoint.
Oh, okay. Yep. So we can go like...
Let me move myself out of the way here for a minute, guys. Okay, there we go. Can you guys type back to me? Can you see or hear me now that I have my my faces back up on the PowerPoint? Oh no, is it working?
Okay, good.
Shoot, it's okay.
Okay, so back to Beestings.
Okay.
They're back. Okay.
So I'm gonna, can I move my face over?
We can put you.
Oh, I can click these things right to move it. Okay.
Try that little one. Yeah, or
okay.
But then once you do it, you have to click that, and it'll put it live.
Okay.
Okay.
So I'm gonna keep. Sorry, guys. I was hoping that my face would not bother you while we're talking up here, but it looks like the audio needs it up there. So I'm gonna kind of move it from each slide. I'll kind of move it around a little bit so you can see the different things. Basically, what I was showing here for that first little bit with the bee stings, it's most common to occur in the mouth because our dogs and cats are at the ground, which is where these bees and wasps are at. And sometimes you'll get these hives that you'll see in this bottom picture over the body because they'll be stepping on them with their paws. Basically, what I covered with this is that I want you to check for bee stingers that could be left, especially if they're in the mouth and underneath the paws that you can pull out. If it's a localized reaction, so it's just the paw that looks swollen, there's a lot of home remedies that you can do online or find online made of baking soda. I always want you checking vitals. And I want you to look at gum color, and I want you to look at respirations, and then you're going to call me. I want everybody to keep Benadryl on hand at home so that you can have it in your pet emergency or pet first aid kit. And Benadryl needs to be the plain Benadryl, no Benadryl D. So if you have to show your driver's license to get the Benadryl, you're getting the wrong kind. It needs to be very basic, no Sudafed in it. Most of these pets are going to do fine at home, but again, I want you to call me and describe what you're seeing. So that way we can make sure that we're staying on track. I'm going to pause for a minute so that way you guys can tell me that you can still hear me and see if you have any questions.
Oh, good.
Okay, I'm going to move on to the next slide, and let's see.
I'm happy to advance the slides for you, whatever's easiest.
So on this one, as I toggle, there we go. We're going to talk about heat stress. And this is very, very common that we're going to see during the summer months. And I'll be honest, this happens more frequently in the spring and the fall. And it's not because of the temperature, it's because we're not as cognizant of how our pets are adjusting to temperature changes. So heat stress can occur at any temperature and any humidity. It's what our body is going to tolerate, or what your pet's body is going to tolerate. So the most common breeds that we're going to see have to deal with older patients, especially if they have an underlying condition. So you've heard of things called collapsing trachea. We've heard of LARPAR, where the dog's laryngeal apparatus isn't working very well. And we've also talked about brachiocephalic breeds. So these are breeds that have a much smushier face, and their tracheas tend to be a lot smaller. The 4 to 5 most common ones that we see are the ones that I listed here, with bulldogs being a huge trigger for this. What happens with these kiddos is that when they're outside playing, they're not able to move the air to cool their bodies down. We know that dogs and cats do not sweat like people do. They're going to release a lot of their heat through their paw pads and by breathing it back out. And this is particular in our cats too. So a lot of our cats that have the smushy faces, our Persians, our Himalayans, they're going to have the same type of difficulties of releasing their heat and expelling that energy out. So if you have an animal that's outside in the heat, going for walks, runs, that sort of thing, and you're suspicious of heat stress, signs of collapse, if they have bright red gums, a lot of them are going to hypersalivate because they hypersalivate when they're stressed. You may see bloody diarrhea that can occur anywhere from 15 minutes to several hours afterwards. And obviously signs of respiratory distress is what we're looking for. One of the things that will be helpful at home for you guys is to check their temperature. The safe way to do this is to always use a digital thermometer. Please do not use any mercury thermometers if you still have them. And also know that the digital scanners across the foreheads or in the ears do not work very well for our pets. They have too much hair and it can't read through their hair very well. You are going to do this rectally, so please be safe. If your pet is too anxious or too frantic, I don't want anybody getting bit. But if your pet will allow you, you can put a little bit of lube at the end of that thermometer. You only insert it just enough to where the tip of the thermometer is covered and you can see what their temperature is reading. It is helpful to have a little bit of lube on the end of your thermometer, so you could use a sterile lube, a KY lube, or just a little bit of some dish soap would even be fine, just a tad bit. Dog and cat temperatures are going to be different for people. People, we say we like it to be around that 98, 97. Dogs can be safe and cats can be safe up to 102.5. But if we start seeing 103, 4, 5, I've even had dogs at 107. Those are not safe temperatures for them to be at. Their body cannot handle that. The biggest thing you can do before coming to see me is to start cooling at home. Cooling at home is going to be a gentle cooling. We do not want to drop their body temperature rapidly. So the rule of thumb is that however high they are, doesn't matter if they're 107 or 105, we want to stop at 103. I do not want anybody cooling under 103. Once you do that, you can start to cause a hypothermia, and we don't want to cause the reverse effects. So rubbing alcohol works really well on the paw pads of your kiddos. You can even do like cool towels. You do not have to do ice. I'm not asking you to ice anything. I don't want to damage the skin, but getting your towels cool water and draping them over the trunks of their body, their armpits, and even their inguinal areas will help to cool them down. Please, please, please remember, if you are outside doing this, check to make sure that your hose water has been completely cleared. I've had several cases where the owner went to put water on their dog, but there was water residual in the hose and they burned their dog instead of cooling their dog. So please remember to check that the water is cool that's coming out beforehand. If your pet will drink, you can go ahead and give water, but please do not force it. If they're panting enough and salivating enough that they can't drink, I don't want you to force anything. We do need to check them out. 100% we need to get them checked out. The reason is there's a lot of secondary complications that can occur with these kiddos. We can see anything from bloody diarrhea, which is manageable. The shock organ in the dog is the gut. So when they go through this big event, it is common to see bloody diarrhea, and we want to take care of that. They can also have more severe effects such as seizures, tremors. They can have respiratory problems, and some can even go into DIC or like a sepsis state. Their blood can get so hot that it actually starts to break down and they bleed internally. It's very, very important for us to get checked out on this, even after you do your active cooling at home. I'm going to switch over to the chat here. Let me know if anybody has any questions on this before we move to the next slide. Okay, so one question while you guys are waiting on this, someone asked how to give Benadryl to a cat. So here's one thing I will warn you guys about. Antihistamines over the counter will make cats hypersalivate. It happens. So when you do it, liquid does tend to be easier if it's in a small amount. If you're comfortable pilling a cat, you can open their mouth and put the pill in. They will have less hypersalivation that way. Liquid will make them salivate, but it is easier sometimes to give the liquid. My recommendation is giving the pill and then allowing them to eat something yummy like tuna juice, a little bit of chicken juice, chicken broth, something that will wash that down so that they don't have that flavor in there. Okay, I'm going to move to the next slide. So this is another common thing. This little kiddo here has what we see as a puncture wound over the shoulder. Summertime, springtime, even fall when the weather's nice, we tend to want to be outside more. We're on the bike trails. We have a lot of nice dog parks in the area. It's inevitable that we're going to see some bite wounds that take place. Here's the thing that we have to all be cognizant about on bite wounds. They have to get checked out. No bite wound is too small. If you think about it, if everybody right now looks into the mouth of their own pet, even if you just had a dental done, you will see some sort of a plaque on the teeth or tartar on the teeth. Anytime a bite wound occurs, that's going directly into the skin and the muscle of that pet. So whether it's a cat bite, a dog bite, I don't care which one it is, we want to get that checked out. Bacteria is going to be there. Superficial bite wounds are going to have more aerobic bacteria, which is ones that are more susceptible to air, lives on the skin surface. What really gets pets is when we get the anaerobic. So there's a big tooth that goes down into the muscle. There's not as much oxygen in there, and so that will brew like crazy. And that's when we see bruising, and that's when we see necrosis take place underneath the skin. The other reason that I get these kids checked out is after the adrenaline wears off, 12 to 72 hours afterwards, your kiddos are going to be painful, quite painful, especially if there was a big tooth that hit any type of a major muscle group. You're going to see some muscle trauma and it's going to be painful for them. So we want to get them started on medications as soon as we can. What you can do at home before you bring them in, and again, my biggest rule of thumb is I don't want anybody to get bit. If your pet is way too fractious, anxious, or painful, you don't need to do any of these things. You bring them straight in. If you're able to, gently cleansing the area with lukewarm water is totally fine. You can do a little hose over the area. You can just simply apply a warm washcloth just to kind of clean out any major dirt or germs that might be on the top. I don't advise using hydrogen peroxide. What we have to remember about hydrogen peroxide is that it actually can cause some tissue necrosis because it bubbles on that surface. So when we have fresh tissue exposed, you can actually cause more harm than good. So please don't use the hydrogen peroxide, just basic little water pulsion. If there is active bleeding, a gentle pressure is all that we need to help control the bleeding until you can come in. I don't advise topicals. So what topicals will do is you'll actually trap that hole, or you'll cover that hole up. It'll trap and suffocate any bacteria that's underneath there. And that's when you get the anaerobic bacteria that really go crazy. And those are the ones that are harder to control. And those are the ones that cause more damage. Once you guys are in here and we're able to start medications, hydrotherapy at home is a great way to help treat wounds. Hydrotherapy is used in human medicine quite a bit, and so essentially you are just using basic water pressure over the area to massage it. And so that massaging dilutes or opens up and dilates the blood vessels. Those blood vessels allow for white blood cells to come in, and it will actually help clear up your infection a lot faster. So hydrotherapy is a great thing to do. Again, if your pet will tolerate it. If not, not a big deal. We can look at other modalities. Safety is always going to be our first thing. Any questions about bite wounds? Okay, we're going to move on. Okay, we're going to move to the next slide. Let me move myself here. All right, here's the big one. Hit by something, right? Something with wheels. We've seen hit by cars. We've seen fallen out of Jeeps. We've seen hit by four-wheelers, side-by-sides, trains. I had a horse and buggy that ran over an animal, a dog, before. So you name it, it can happen, right? Our pets are just crazy. They love to run and get into trouble, and it's hard to see them when we're on these vehicles. I always get them checked out, and I'm going to show you 3 major reasons why we want to do this. The first obvious reason that we're going to see are fractures, right? A broken bone. The most common are going to be your long bones, which are your forelimbs and your hind limbs. Here's an example on an x-ray of a femur that is broken. The femur is right here, and obviously you can see that is not aligned appropriately. When we have this, sometimes it's going to be obvious. You're going to see them dragging the leg. They're not bearing weight on it. You'll see swelling that's there. They may be super painful. They may be yelping. It might be pretty obvious. Sometimes it's not going to be obvious. If it's not as big of a bone or it's lower on the limb, sometimes you're not going to see quite as much, but they may not be acting right, or they may not be walking as well. One of the things that you can do before you bring them in is to try to make just a little bit of support for them. Again, the key here is do not get bit. If your dog is too painful and it will not let you wrap a towel or blanket, then you don't do it. You just bring them in, we'll help take care of it. If they will, anytime that we can put support around it, the less muscle damage that we're going to do, the less vessel damage that we're going to do. A simple, thick padded towel or a blanket, such as a comforter or maybe an old toddler's blanket, just by wrapping it around that leg. I'm not asking you to put it back in line. I'm just asking you to wrap it around for support. And then just wrap some duct tape around it to hold it in place. Very simple. All you need to do is for stabilization. One of the other common things that we see is a pneumothorax. See it there, but it's not on my screen. Give me 1 second. I think my slide is not advancing.
Let's pull this over again. Kind of like refresh it or something.
Sorry guys, there's a little delay from my one computer, so give me 1 second to move this here. I have some fun pictures that we're trying to bring up.
We have a backup plan. We can do this too. We can pull up this. Oh, you know what? We need to turn the audio off. Okay, I guess it's the same. Oh wait, let's go to the right slide. There we go. Okay. It's not going to do that thing where they come in one at a time. Okay.
Okay. So on this slide, what we're looking at, sorry, I had to kind of switch it up. So you guys should still all be able to hear me. If not, send me a message if you can't. So on this slide, what we're looking at is pneumothorax. So this one is really tricky, guys. This sometimes doesn't occur right away. This can happen anywhere from several hours up to a day afterwards. And if you look on my screen here, and I'm going to move my mouse, so hopefully you can see my mouse, but this is the heart, and the heart is not sitting on the sternum down here. So the heart is up, the sternum is down below, and there's black between that. That is free air, and that is air that's lifting that heart up off of there. And that can make these dogs really hard to breathe. So that is a big sign that we want to check for. If that gets too severe, we actually have to do a chest tap and take that air off of there. This can occur in cats and dogs of any kind. So we always want to have these preliminary x-rays checked to make sure this isn't occurring. The other thing that we can see is a ruptured bladder. So if you look on my third x-ray over here, this is actually the white is where we've actually used a contrast to put into the bladder. If a bladder is intact, that white should stay just consumed into that bladder. But you can see on this x-ray that there's actually white that's starting to float out and above it. And that means that there is a hole or an extra opening in that bladder. And so when a tire runs over a pet, it can put enough pressure in the abdomen that we see these holes or these leaks in the bladder. And this is important. We don't want urine floating into our abdomen. These are life-threatening things that we need to make sure that we're handling and taking care of.
Do you want to do questions first?
Okay, anybody have any questions on this before I move to the next screen? You can type it on the chat button there.
Okay.
It's a little delayed there, but that's okay.
So the next one.
Yep. So no flying in, right?
Right. Okay, now we have to go back to our You worked hard on your flies, didn't you?
Mhm.
Okay, that's this one.
Okay. So the next thing we're going to talk about are fireworks because it's that season. It totally... What happened? That happened. That one went right.
Oh,
yep,
yeah.
we
Oh,
went
that's
back.
this one. Okay, hold on.
There we go. All right, it's that season. It's firework time. As pretty as they are, we know that a lot of our pets do not tolerate this very well. So there's some pretty basic things that we can do to try to help you guys and to help your kiddos at home. And sadly enough, this isn't just a dog thing. Cats are just as scared of the loud noises going on outside as well. If you know that your pet is having issues being scared, staying home is the best. Stay home with them, give them support. Distraction, play with them. Any physical activity, playing ball, walking them around the house, little obstacles for them to walk through, even just chewing toys, holding bones for them are all good distractions. And obviously sound. Have the TV up, have the radio going. Interior rooms are obviously more quiet than exterior. So if you've got an interior bedroom or even a basement that you can sit in, a lot, I shouldn't say a lot, I would say some of our pets do like that swaddled effect. So we have sensors that are all on the outside of our body. That's what makes us feel good when we get a hug. We feel safe and secure. Dogs have these same type of sensors, and so do cats. Some are going to be more prone to it than others. If your dog wants to be in your lap, they want to hide under the cover, wrap them up, swaddle them up safely. They actually make a shirt called a Thunder shirt that you can get on Amazon. They make it for cats and dogs alike, multiple different sizes. So if your pet is one that really likes that touch, those shirts can help bring them a calming sense. You can read about different scents in the house. So lavender tends to be a calming smell for pets. I advise against not using heavy potpourris or heavy diffusers, as those can sometimes trigger allergy effects or asthma effects in your pet. So make sure it's not overwhelming or overpowerful. And again, worst case, never underestimate the power of drugs. That's why we're here. We can help with this. There are very simple and safe medications that we can give you to help your pets have a more pleasant experience. We don't want them to be having those panic attacks in the house. So please don't be afraid to call us and ask us for help. That's what we're here for. Any questions about this slide before we move on? Do you want me to try to reset it back to that thing again? It still isn't moving, is it?
It's not moving.
Okay.
Okay.
All right, so the next thing that we're going to talk about is burns. Yep, it's over there.
Okay.
So this is an unfortunate part sometimes of our summertime. Burns can come from fireworks. We've seen that happen where the firework falls over and animals, people alike, can get burned. The other thing that I think sometimes we forget about and is the most common is exactly what you see in this picture, paw pads being burned. And this happens with our grills. So a lot of us like charcoal grills. They're great, tasty food. But when you dump that charcoal out, we tend to see these pets, and cats are no different, will walk over those coals because they're not paying attention. And you can actually get that sloughing of the paw pad or any other part of the body for that matter. I always advise you to get these kiddos checked out. Burns can be a high chance of infection, and they can be very, very painful for these kiddos. Before you come in, so if you just see this happening, it is okay to put a light wrap on that to protect it. I want you to protect it from any other damage that could take place, pain from walking on it, just a light wet wrap. I don't need hot water. I don't need cold water. I just need just a light protection, and the moisture helps. It is okay to use triple antibiotic for a very short term, just to help keep that tissue moist so that it doesn't get hard and crusty and painful. Healing does depend on the degree of burn. So how many layers are affected, how much of the body is affected, and where on the body. Paw pads are obviously going to be more painful and a little bit longer in recovery than just on our skin because our dogs walk on them so much. I ask that you don't use remedies such as butter or oils. Those are not going to be protective to the skin. They're just going to create more of a mess that I have to clean off, and they prevent us from getting to the root of the source and trying to get that taken care of. There are a lot of bandages that we can do at home. There are some therapeutic oils that we can give you after we assess the pet and determine if it's appropriate. So there are some things that we use that we talk about as far as raw honey that are really good for wound care, but it really does depend on the degree and where those burns are located. So those might be things that we talk about, but I still advise you not to start them without referring to us first. Any questions about burns? Nope. Do you want me to try this one?
You can. I think it would show
Okay.
if it was. So go to the PDF. Yeah, just go down.
Here. Nope.
Oh yes, but watch. There we go.
Okay.
You should be good, but maybe just double check.
Where did I go back?
Touchscreen.
All right, so briefly a few things to touch about on barbecues. They're fun, everybody enjoys them, lots of people bring their pets to it. We talked about bite wounds already, which can happen. Obviously, lots of people, lots of noise, other pets, so we know that bite wounds are a concern. Here's something that we don't think about. This x-ray that we have here, everybody see this dog has bright white things floating through it? Let me see if my mouse will right here, and then obviously through here. So looking at that, those are rocks, my friends. And those rocks were ingested by this dog because at the barbecue that the dog was at, the owner dripped the grease pan out into the driveway over the rocks. So we have to be very careful. Wherever this grease is going, our pets are going to find it. This dog found the grease, wanted to eat the grease. It was great, but as it did that, it ingested all these rocks. And this was obviously a surgical case that we needed to do. So I always advise finding different places to pour your grease or any of your scraps of food. Bones are the same way. Anytime those rib bones are done, throwing them outside, our pets are going to get a hold of it, and those can cause some serious issues leading to surgery. The other thing is people food in general. If anybody's heard of a condition called pancreatitis, pancreatitis has to deal with the pancreas, which you can see on the screen. I've got it labeled here. It's this yellow kind of a triangular shaped organ here. And the pancreas is used in the body to help secrete digestive enzymes and break down food, and it helps to regulate insulin and blood sugar. When you eat a fatty meal, or a dog does, or food that it's not normal to, this pancreas will get very inflamed, and it causes a pretty terrible abdominal pain. They have vomiting, fever, diarrhea, lack of appetite. Dogs who are painful from this can go into what we call the praying position, which is what you see with this dog at the top of your screen. They tend to put their front part down and their back part up, and they're stretching out their belly because their belly hurts. Some dogs will roll on their back and stretch. Some will even army crawl across the floor because they're uncomfortable. These are situations that need to be addressed either. Some of these pets are going to be able to be treated at home depending on their severity. Some of them are going to need to be treated with hospitalization, and it really depends on how well they can tolerate the pain, whether they're able to eat, and obviously we want to control any dehydration that takes place. So this can be a serious thing. There are pets that do die from this as it gets severe enough. So I always ask everybody, if you know you've been somewhere, your pets have been eating food that's not their normal diet, keep an eye out. The first sign that we see of this, I want to know about it. Is it?
The down one. Yep.
Is it?
No.
No?
Yep. Middle.
Okay, I'm going to go ahead and move on here. And again, if you have questions at the end, you can always type them at the end, or you can shoot me an email, and I'm more than happy to help. I want to move on to hiking, which is a great pastime outside for a lot of people and their pets. A few things to cover with this. Fly strike can occur when there's a heavy burdens of flies that are around your pet. This is on the ear, which is the most common. You can see it right here, and it's basically an ulceration with black crusty stuff. It can happen on any part of the ear. Usually we see it at the tip of the ear though. So if you see this, let us know. There's different topicals. One of my clients used to sell Avon, and it had a Skin So Soft by Avon. So if you know of anybody that has it, it's a very mild cleanser, but actually repels the flies, and it helps in healing. So a little tidbit there if you know someone. Poison ivy is also very common. You can see in the picture up there, it does cause a rash and pustules on dogs if it's left to contact. The good news is this is not transferable to people. So even if those pustules are on there, you have to get it from the plant, not this dog. So you are okay to help treat your dog. The biggest prevention you can do is after you go hiking and you get back to your car, carry baby wipes with you, the unscented kind. Wipe your dog down everywhere that's going to be contact, the trunk of the body, the underside of the body, all the feet, the little paws, and the legs to try to wipe off everything. Once you get home, a nice bath with the blue, and I stress the blue because the blue does not have any perfume or scents in it that can cause issues to dog skin. So the blue Dawn dish soap is a very mild yet powerful cleanser that we can use. Some people have asked what happens if your dog eats poison ivy. It can cause an upset stomach. Sometimes it can lead to diarrhea. 9 times out of 10, it is self-limiting, but diarrhea can be common, so something to watch out for. It doesn't usually cause any pustules or rash in the mouth, though. It's more of a GI thing that takes place. So heartworms, you're going to hear us talk about this a lot when you come into the clinic. This is one of my soapboxes I'm going to get on, but I will keep this quick for you guys. But just so you understand the importance of why we use heartworm prevention. Mosquitoes this time of year, Southern Illinois, Southern Missouri, this is a real thing. Heartworms do happen. Just a fun fact, I recently had a patient that we diagnosed with heartworms. The dog was collapsing at home. We found these heartworms. The burden was so severe that I couldn't do regular treatment. Sent it to the university. They actually did a surgery where they used an instrument, went into the heart, and had to extract worms out of the heart in order to save this dog's life. We don't want that to happen. For the simple amount that you can give your dog a pill every month or a topical for it, it's very important. This is a brief overview of the life cycle, which I think is really important for us to know. Mosquitoes carry the larva, right? They bite your dog. It's going to migrate through the blood vessels, and those larvae are going to mature into the adult heartworms. They release the microfilaria, and that microfilaria takes about 6 months. This is why detection occurs after 6 months of being bitten. So if you come to me in August and say, hey, August 1st, I did not have my dog on heartworm prevention, I can't truly tell you if it's negative until 6 months later. So we're looking into the spring. That's the life cycle of it. So it's very important to keep our pets on these. When you have it on there, what your preventative is doing is your preventative is working on that larva. When that mosquito bites your dog, if you are on heartworm prevention, that heartworm prevention is going to prevent that larva from developing into the adult heartworm. The other thing that's important to know is if your dog is heartworm positive, a lot of people ask, is it safe to even give prevention? It's safe to give a very specific one called HeartGuard. If you give the other ones, they can actually kill a lot of those babies too quickly, and that can cause your dog to have an anaphylactic reaction or a dead worm burden, which can actually clog some of the arteries or vessels in your pet. So again, these things can be prevented by giving your monthly prevention. But again, mosquitoes are common. Heartworms are common. It's for dogs. Cats do get heartworms. It's at a very much lower rate. Cats are going to present a little bit different than dogs. Dogs are going to be lethargic. They're going to have weight loss. They're going to be coughing. Their pulses are going to be bounding on their neck sometimes. Cats are going to look more like a respiratory. They're going to cough. They're going to have a wheeze, and they're going to have trouble moving air. So a little bit different thing. Cats do not have a test that's as readily and as cheap as available as dogs. So we have a little bit more work that we have to do when we're looking at cats. Okay, the last thing as far as hiking is concerned or being outdoors that I want to hit upon are ticks. We know the ticks are out here. There's a lot of them. There are 4 main kinds of ticks that do occur in Illinois that I've listed here with the American dog tick, the Lone Star tick, the deer tick, the brown tick. The winter tick is one that we see. It's not quite as common, but it's here. In Illinois, the adults, ticks are going to be more active in April, May, and June. And again, there are obviously diseases that we're worried about, both as humans and, of course, to our dogs and cats as well. Cats are not going to be nearly as susceptible to this. So cats don't usually develop the Lyme disease. This is going to focus more on dogs on this slide. The interesting thing is what we hear about the most is Lyme disease. Lyme disease is transmitted by the deer tick. Here's what we need to know about it, though. In order for a tick to transmit the Lyme, or Ehrlichia, whichever disease that we're talking about, it needs to be attached to the host and having a blood meal, meaning it has to not just bite it, but it has to suck that blood from the host anywhere from 36 to 48 hours. When it's taking that meal during that time, that's when it's able to pass it back. So what you need to know about this is that if you just went on a hike, you came back home, you found a tick on your dog, you can remove that, and you got home in 4 hours, you're less likely to have a chance of developing Lyme disease. 3 to 4 days down the road, you find that engorged tick, we might worry a little bit more that something could happen. There are a wide variety of symptoms that we're looking for, but there is a lot of testing that is available for this, and a lot of the testing is very reasonable. When we look at prevention and we talk about flea and tick prevention, the prevention is aimed at killing the tick between 2 to 12 hours after being on your pet. So yes, you may use that tick prevention and you may be frustrated that you see a tick on it, but remember the goal is not to repel it off the body. The goal is that that tick did not stay on long enough to transmit that disease. So it bites, it dies, it falls off. Those are the goals of the oral ones. Some of your tick collars, they will repel, but remember that if you have a big dog, that it may not always reach the far end of the dog. So always check the back end as well. My biggest thing that I want to preach to everybody is when you go to remove a tick, one, if you don't feel comfortable, bring your pet here. We will simply remove it. We don't mind doing it. We do it all the time. That's our job to make sure that it's done appropriately. Please, please, please do not light a match. Do not try to set it on fire. Yes, fire kills ticks, but not while it's attached to your pet or your body. Simply getting a cotton ball of rubbing alcohol and placing it over the tick for a minute or two will start to suffocate that tick. It will loosen it up, and with tweezers, you should be able to pull that out. Again, if you're not comfortable with it, please, please, please call us. We are more than happy to help with this.
Got the algae? Okay.
I put a diagram on here of just some ticks for you guys. You can see where they start little as the nymph stage and how they grow when they get engorged. It kind of helps some people to see this, to know what ticks are what kind. If you want this in a bigger format, I can always give it to you. Okay, bear with me. We're almost finishing up here. Just two other things I wanted to touch on for you real quick. One of the things that we encountered a lot last year was the blue-green algae. If anybody has heard about that, it's the green thick scum, or algae as it is, that can cover any type of a pond or a stagnant water. Sometimes you'll see this in rivers. However, the rivers, usually it's when they're stagnant and they're not flowing as well. It's an actual bacteria that actually lives in here that causes us problems. It can be difficult to tell if a pond has this or not. You can see in my top picture that there's quite some nice blue water back there, and then we've got this blue-green algae forming on the edges. Just because your dog doesn't drink from the algae, just drinking from the other part of the water can still help them to ingest this terrible, terrible bacteria. Likewise, in the bottom picture, the water looks pretty clear, but you can see that algae kind of resting on the bottom of it there and kind of sitting in that sandy, mucky area. If you're concerned and you don't know how to tell, your local health department does keep a list of local ponds and lakes that have been tested positive for blue-green algae. And if you call them with a concern about even your own personal one, they will come out and test them. So something to know that your local health department can help with this. If you see dead fish, number one sign, never let your dog or cat, any animal, drink from a pool of water that has dead fish in it. That is one of our biggest clues that there is the algae that's present. And then obviously we're looking for the color of the water. What's really scary about this, it's very severe neurologic signs and respiratory signs. They can occur anywhere from 15 minutes after ingestion up to several days. Once these signs occur, there is not a lot that I can do. I can provide supportive care to try to control the seizures or the tremors. I can try to intubate and control oxygen and airway, but it's time and supportive care, and it really does carry a poor prognosis. More animals die from this than survive from it. So best case prevention, carry a bottle of water, carry a collapsible bowl with you anytime that you're out. That's going to be your best bet. All right, we are on our last slide. Thank you guys for staying with me here. This is the last thing I want to talk about is some plant toxicities and mulch. The big thing with mulch is there was a really big popularity of chocolate mulch. This chocolate actually has some cocoa in it. People like the smell of it. They like the look and the color. Dogs, cats, they love it too. Who wouldn't want chocolate? Chocolate is toxic. It doesn't matter if it comes in a candy bar or if it's in your mulch. I really, really recommend that if you have animals that are in your backyard or anywhere that can get close to it, don't use the chocolate mulch. It's just not worth it for the signs that they can develop. Plants can cause a lot of signs. This time of year, there's a lot blooming in our backyards. Most of them are going to cause GI upset. However, there are a few select that can cause some kidney issues. The lilies are the biggest ones. If you're not sure, the biggest help that you guys can be to us is taking a photo of the plant. And if you know the name of the plant, that's going to be helpful as well. But photos do help us out quite a bit. We can usually do quite a bit of research if we can at least have a photo. Also remember, the most toxic part of the plants are going to be your berries, the pits, and then the roots. Those are going to be the most. Sometimes you will see, obviously with some of the lilies, the petals are going to do it, and some of the leaves, especially in your hostas. But if you've got berries coming off of it, or you've got pits coming off of it, or the roots are coming up, those are going to definitely get you more than anything. But anytime you can get a picture or even bring in a piece of the plant that they chewed on is going to be quite helpful for us. Yep. Switch from giving Simparica and Heartguard to just giving Simparica Trio. Simparica Trio should not have Heartguard in it. Okay, so this is the end of my presentation. I want to, I know we kind of went through it a little quickly. I don't want to take too much time up. I know our time is really valuable in the evenings, but I kind of wanted to touch base on some of the big things that we see. We also are going to have this posted on our new YouTube channel from Hawthorne. So if you go to the Hawthorne YouTube channel, you'll see this really cool fact. You'll also see videos from some of the other doctors that work here at Hawthorne giving you some really nice short 2 to 3 minute tidbits on different services that we offer here, common things that people ask us about, different questions that come up. So check that out. There's a lot on there. Also, don't forget our our Facebook has quite a few videos that we've recently added on, specifically nail trims for cats and dogs. How do you do it? Positive ways. You know, there was some funny stuff floating around Facebook of how to do nail trims. We'd prefer you do it our way instead of their way, just to be safe. So those things are all on there, and you can definitely check that out and see these presentations, which is super helpful.
Remind them of sit, stay, heals if they want to take a picture and, you know, the texting leave.
Oh, there's a texting thing too that is called sit, stay,
Heal.
and heal. And I think you can find that on our website. There's a link on it that you can use for texting also different questions or pictures, especially the plant that you had a question about, the bump that from the poison ivy. Those are things that we can help you with through telemedicine, especially since it's kind of hard getting in and out with the COVID. So definitely let me know how you guys felt about this, doing it online. I know it's not quite as fun as being in person, but anytime we can reach out to you, it would be awesome. I saw one question that popped up here. First of all, about Simparica and Heartguard versus Simparica Trio. Simparica Trio is new that it's out. I haven't seen as much of the efficacy of that right now. It says that you were using the Simparica with the Heartguard. I think that's a really good coverage for you, especially if you're out and about. I will message you in a little bit, and I'll get you some more information on the Simparica Trio, because there are some things that we have to watch for and learn about that. So one of the other questions that we had was about Sentinel versus HeartGuard. And I totally get it. There are so many different products out there right now, and it's hard to keep track even sometimes for us which product does which thing. Remember that Sentinel will cover your fleas, intestinal parasites, and heartworms. HeartGuard is only going to do heartworms. So if your pet has any exposure to fleas outside, you're going to want to stick with that Sentinel, or you're going to need to pair in a flea prevention with that HeartGuard. So there's different combinations that we can work with you. Not everyone is right or wrong. It really depends on the lifestyle of your pet. So please feel free, if you're questioning what you have or what's better, shoot us that text message on that weave or shoot us an email and we can definitely help figure out what's better. Somebody asked if I do see appointments, and I do. I like doing these educational things for fun, but yes, I'm always in the office. The days that I'm here, you can definitely schedule with me. We've got 10 other doctors that are also here working that can also help you as well. So please don't hesitate. Anybody here on the staff is amazing to work with. Okay, I think with that, I'm going to sign out. I will leave the chat part open for a few minutes. If anybody wants to chat, I can do the chatting back. I'll go ahead and turn the computer part off and the live feed to give you guys a break. And again, don't forget about emailing us, calling us, or using the texting for any questions. Thank you, guys. It was good to see everybody, especially not having to wear a mask in here. Get to have some freedom. Thank you.